Imagine a scenario. You're in the emergency department and you feel like the wheels are about to come off. You walk into an overcrowded ER with multiple patients waiting and multiple sick patients already in rooms. In turnover, your colleague tells you this one may code, and then they do. You're intubating with a resident and someone hands you a STEMI EKG. Those shifts teach you something. When people hear the term efficiency in the ER, they often think about speed, see more patients, move faster, click faster, talk faster. But that's not what real efficiency is. To me, efficiency is simple. Move the right patient to the right next step at the right time. Hi, everyone. I'm Dr. Gavin Rogers, and in this episode of TSN 5, I want to talk to you about ER efficiency without cutting corners. Efficiency is different from rushing. Rushing creates noise, while efficiency removes friction. And that matters because your brain has a limited working bandwidth. Real efficiency means reducing unnecessary mental clutter so you can spend your cognitive bandwidth on acuity, judgment, and disposition. And in emergency medicine, your most precious resource is not time, it's attention. That's the first big idea that I want to talk to you about. You have to triage your attention, not just your patients. At the start of a shift, high performers do not simply pick up the next chart and go. They do a department scan. Who's the sickest? Who could deteriorate? Who is blocking flow? And what can I do in the next 10 to 30 minutes as I start my shift that will make the whole department safer and run smoother? That mindset changes everything. So your job is not just to work harder. Your job is to put attention where it has the highest value. The second big idea is that for each patient, be focused early. Do a chart biopsy, not a chart autopsy. You don't need the entire biography before you walk into the room. You need the triage note, the vitals, the chief complaint, and a few important comorbidities, and any immediate relevant old labs, imaging, or admissions. At bedside, your first pass should not be all of the details that the patient can give you, but what could hurt this patient right now? What diagnosis do I have to catch or can't miss? And what resources is this patient likely to need? That's where efficiency lives, not in collecting more words, but in collecting the right words. Third thing I want to talk about is front load what only you can do. If they need a procedure, get it moving early. If they're getting admitted, start shaping that path. Delayed physician actions become bottlenecks later, and bottlenecks are where the whole shift starts to feel sticky. The same goes for reassessment. Reassessment is where disposition happens. Ask yourself early, what has to happen before this patient can go home? What social, medical, or operational barriers are going to slow this case down? That question alone will make your next shift better. Fourth, communication is one of the highest yield efficiency tools in the department. Good communication reduces delay, not just with patients, but with nurses. Clarify urgency, say what matters now, and close the loop. As residents, give your working diagnosis, your bottom line up front, what you've done, what you're unsure about, and what decisions you need help making. With consultants, that bottom line up front matters. I have a patient that I'd like to admit to the hospital for sepsis. Why am I calling? What's already been done? And what do you need from your consultant? Finally, protect your brain. The ER is an interruption machine. We get interrupted on average 10 times per hour. And if every interruption fully disrails you, your cognition gets shredded. So when possible, finish the critical task before you pivot. Batch your tasks and mark your return point. And yes, documentation. You have to document with a purpose. Your note should support care, communication, and medical decision-making, as well as your disposition, but it should not consume your entire shift. Efficiency is not frantic, it's not detached, it's not reckless. It's clinically sharp, cognitively organized, and operationally aware. The goal is to think clearly enough, communicate well enough, and move deliberately enough that the department works better because you're in it. So what are the 5 key takeaways from this episode? Number 1. Efficiency is not speed. It's moving the right patient to the right next step at the right time. Number 2, triage your attention. Start each shift by asking where your attention will have the highest value. Number 3, do physician-dependent actions early. Don't let those become bottlenecks. Think about your disposition and reassess each patient quickly, but with purpose. Number 4, protect cognition and preserve empathy. Batch your tasks, manage your interruptions, communicate clearly, and don't let efficiency turn you into a robot. And number 5, be disposition aware. Think about from the beginning where this patient needs to go and order intentionally so that every patient gets to the right place at the right time. Efficiency is not about moving faster through chaos. It's about thinking clearly enough to bring order to it. Real efficiency is what happens when skill, structure, and calm all show up at the same time.